Hello, my name's Amelia. I will be doing my presentation on Valium. So our brand name is Valium or Diastat, and our generic is diazepam. The class of this medication is benzodiazepine. It is an anti-anxiety agent, a muscle relaxer, and anticonvulsant, and also a GABA positive allosteric modulator. And just to note, it's a Schedule 4 controlled substance. So this medication is going to be prescribed for anxiety disorders, which includes things like PTSD and OCD, short-term treatment of symptoms of anxiety, which can include pre-procedure anxiety, acute alcohol withdrawal symptoms such as agitation, tremor, delirium, skeletal muscle spasms, spasticity caused by upper motor neuron disorders such as MS, athetosis, which is slow involuntary writhing, stiff person syndrome, which is a progressive neurological disorder where the person literally is stiff and it gets worse as time goes on, convulsive disorders, and can be used in the initial treatment of status epilepticus. It works by binding the benzodiazepine receptors in the GABA-A ligand-gated chloride channel complex. It inhibits neuronal activity in the amygdala, which is your fear center, and the cerebral cortex, which is what inhibits the seizures, and the spinal column, which is what helps to reduce muscle spasms. So it will start working on the first dose. Most patients will feel a difference, but could take weeks to achieve full therapeutic effects. So for healthy individuals, you will not need to run any tests, but if you have a patient who has a lot of comorbidities or a seizure disorder or is taking a lot of medications, there is a low risk of hepatotoxicity. So if that does happen, it's most commonly going to happen in the first 6 months. And if you discontinue the medication, most likely it's going to resolve. So for dangerous or life-threatening side effects, you're going to see that rare hepatic dysfunction, renal dysfunction, or blood diseases. And you're going to want to watch for CNS depression. Be sure not to mix this medication with alcohol just because it can cause respiratory depression. And that is going to be exacerbated when alcohol is on board. When stopping the medication, it's very important to taper very slowly because patients could have withdrawal symptoms, which can include seizures, and those seizures can cause death. And just if you are prescribing to someone with a history of addiction, just be sure to monitor that patient closely to make sure that there's not abuse happening with the medication, just because it can be addicting for some people. Other things to educate your patients on would be that this medication could cause some memory loss. Benzodiazepines can have some amnesiac effects to them. It can cause sedation, fatigue, depression, dizziness, ataxia, slurred speech, weakness, confusion, hyperexcitability, nervousness, hypotension, or dry mouth. And in rare cases, it could cause hallucinations and mania. For little ones, obviously their dose is going to be lower, and that different ages and weights are going to require different dosing and routes. And just understanding that the long-term effects have not been studied of diazepam in children. So probably not planning to prescribe this medication long term unless you really have to. For pregnancy and breastfeeding, just important again to remember that the benefit to the mother may outweigh risk to the fetus. And if the mother's already on this medication, even though it's generally not recommended to be on it during pregnancy, it's not an absolute contradiction, and that discontinuing could cause the mother to have seizures, which would end up causing harm to the fetus. So just being sure that if the team decides that they do want the patient off the medication, or the patient decides they want to be off the medication, give them a very slow taper. And if they decide to stay on it, remembering that the newborn may have some signs of withdrawal, or that they may experience neonatal flaccidity. So watching for that at delivery. Breastfeeding is not recommended, but also not completely contraindicated, just knowing it could cause sedation in the baby, which could lead to feeding difficulties and weight loss. In elderly, you're going to want to watch for increased risk of the negative side effects like falling, feeling really dizzy, feeling kind of out of it, and knowing lower doses may be effective because they may have some kidney problems that could cause reduced clearance of the medication. An interesting fact about Valium is that it became very popular when it first came out on the market. It was very safe and highly effective. And so from 1968 to 1982, it was the top prescribed medication, despite that we did not know the mechanism of action for another 15 years. And it was very popular because it really treated the anxiety rather than just like totally covering up all the symptoms by like over sedating the patient. And some medications that were used prior were things like barbiturates, opiates, and alcohol. And those were kind of hard to safely dose. So, you can see here the Valium pill shape is pretty remarkable. Just having the V in it, very like eye-catching and clearly name brand. And these are my references. And thank you so much for watching and listening.